All right, good morning, everybody. This is Andrew Cole with the East Orlando Chamber of Commerce, and we really appreciate you here today joining us for our Health Council Collaborative. And this is brought to you today by The Bridge at Orlando. We have Carol Daniels, who I'll be introducing here once again with everything there. But I do want to welcome you here, welcome you to another wonderful chamber event that we're doing. This is going to be a little different today. We're going to do some fun, not activity, but we're going to break you up so you have some opportunity to network with some folks. So we're going to try some things here with you on that. But without further ado, I do want to recognize and say thank you to PowerNet, who is powering our webinar today. They're members of the Chamber, and we appreciate what they do to help provide and put this platform on for us here. I also want to make sure that we recognize our East Orlando Chamber trustees. And those trustees are Advent Health, Avalon Park Group, Avalon Insurance Services, Duke Energy, Fairwinds Credit Union, Great Florida Insurance of Hunters Creek, Orlando Health, Suburban Land Reserve, and the Orlando Law Group. So I do want to bring up and introduce Carol Daniels with The Bridge at Orlando. And Carol, if you want to take a few seconds here and you want to say, welcome everybody and let everybody know about The Bridge. This was going to be an in-person event today, but due to wonderful COVID-19, we are here now virtually. So Carol, I'm going to give you the mic, and if you want to share a screen, let us know. We can take care of that, and I'll stop sharing this one, and we want to introduce you.
Well, good morning. Thank you for joining us. I feel very blessed that we've come up with this format. Thank you to the Chamber to still have a little connection, and but on the other hand, not to be sensitive to COVID, of course. So I'm going to just show a little video about us, and let me see if I can share my screen. Let's see. Oh, here we go. Uh-oh, is it working? Do you see my screen?
Yes.
Okay. Yep.
No?
That's sunset.
Yeah. All right, let's see if this will play. Well, I did work on it last night, and now nothing. Okay. Well, let me just tell you about us. Obviously, we're assisted living, and during this crisis, we are trying to help people the best we can. We are taking admissions and such, but I would love to see you all come by someday, but here we are. Okay, it's playing, but now I can't hear it.
If you want to try to unshare, stop sharing, and if you share, make sure you, there should be a video option. I'm not clicking on it because I don't want to interrupt you, but if you want to stop sharing and then share, and then make sure you're selecting for a video and then share your audio.
I do hear it, it's just really quiet.
We are deeply grateful for our family's understanding.
You can just watch.
Well, we've got your email screen is what we're seeing, Carol,
Oh, no.
just so you know.
Okay, stop sharing. I'm so sorry. Okay.
So if it opened up, you have to change to the screen that it opened up in.
All right, that's okay. We can just continue so that we can get going with our agenda.
Sounds like a plan. So tell us about The Bridge real quick. You didn't get into too much. You just said you were assisted living facility. So go ahead and tell us a little bit more about The Bridge, and we'll
So assisted living on the same campus as skilled nursing, so we can transition for everyone depending on what happens in your future. We are accepting admissions at the present time, helping people who are truly in need during this COVID situation. So that's who we are. We've been here for 20 years, and we have a standard assisted living license with care 24/7.
Wonderful. And you guys are located where? Let everybody know where they can find you and how they can, if they're looking to connect with you.
Right, so we're on Roush Road, close to University Boulevard, very close to the 417. So a good location in the East Orlando area. Thank you, Andrew.
Great. And then your website address, so if anybody's looking for you there, and then how can they contact you, Carol?
Right, so I am Carol Daniels at our umbrella is Century Park. So if you just Google the bridge at Orlando, everything you need to know about us is there. And I really hope to show you the video, maybe at the end. So please, I think we're sharing our email addresses. Special surprise.
We will do. So very cool. So we'll make those announcements at the very end for those that have attended. And so let me describe what we're going to do today so that everybody has understanding. I've got a number of facilitators that we have brought together today. They're going to help facilitate some questions, but we're going to divide everybody up into rooms so you have a little bit of an easier time to connect and meet some people that are on this call. So that's going to be some of the networking part. And the design behind this is to see you as a kind of like a discussion with 4 or 5 people, depending on the numbers that we have here. We'll be answering some questions with a facilitator, but to keep conversation moving. You'll have some opportunity to introduce yourselves and to connect with the people in that room and go from there. So I want to introduce our facilitators. One, our host, Carol Daniels, which we really appreciate, with the bridge. Then we have Quentin Gunn with Social Media for Doctors. We have John Kelly, who's publisher of Orlando Medical News. Dennis Ferraro with Kaiser University. And Colin Barta with Functional Neurology Chiropractic over on Cimarron. I always get that twisted around there. So those are our facilitators for today. And you may see myself and or Dorothy jumping in and out of some of these rooms. But while you're in the rooms, we're going to kind of talk about, we've got 3 different topics we're going to discuss, which is on the employee, patients, and also marketing for your groups. So feel free to share anything that you might be having going on in your practice or in your offices that you're working with. Any ideas that might be out there that you're willing to share. And just open up some discussion. And then we're going to bring everybody back into the main room. And then we're going to share what each one of the rooms had and go from there. So when you're asked who you are, please keep it short and brief to your name, your company name, and give us a good lead. So tell everybody in that room who's a good lead, because if they have somebody they can connect you with, they can put that in the chat box, and then feel free to put your contact information in the chat box so that anybody will can contact you from that. Also on that, I just want to let you know, we'll have a survey that'll come out shortly thereafter, and you'll get a 60-second countdown when it's time to come back out. Please jump back into the main room, accept that, and you're going to get a quick notification to join a room. So please also connect with that so we can get you in the correct room so that you can start connecting with the others there. So we've got about 30 minutes we're going to do with that and jump back out into the main room about 8:45. And we're going to go from there. So without further ado, Dorothy, she is going to push the magic button and put us into some rooms. And if anything, if you might see a little people jump around for just a few as we make sure that a facilitator is in a room so they can bring on the questions. So thank you very much, everybody. And we look forward to seeing everybody back in the room in about 30 minutes. So we'll see you shortly.
Oh, good Lord. Okay.
Dorothy, are you there?
Yes, I'm sorry. This is taking a little bit of time, so I'm sorry. It's coming.
It always seems easy to us, the person behind the scenes. So
The IT guy or gal is a genius always.
Dorothy, you get everybody in a room?
I'm getting there.
Okay.
Okay.
All right.
Oh, okay. It looks like everybody's there.
All right. Because it's recording you and me right now, just so you know.
Nice. See, waiting room, who's waiting? Not joined, not joined. All right. Dr. Barbosa and Celia, please accept going into a particular room. Colin, are you in a room?
This is Dr. Bartow. It looks like I am still in the main group chat.
Oh,
Yes, I did accept Dorothy and it kicked me out and I had to log back in.
Oh.
okay. Okay, so I don't see why you are not in a room.
I love technical difficulties. Poor Dorothy.
Wow. Okay. Okay. Where are you?
Is there a missing room?
No, it's a missing Dr. Bartow.
Are we in his room? No?
You're all in my room.
Yeah, you must be in Dr. Bartow's room. So get started.
Hey, good morning. This is Corey. I'm not in a room also.
Yeah, I was gonna say I've got everybody here.
Yeah, I'm seeing 1, 2, 3, 4, 5, 6. Yeah, it's 6 of us. I wonder what happened. I think I know what happened. I was put into Colin Bartow's room, and I was the only one there, and I jumped out, and I may have closed the room by doing so. I wonder if that happened.
Well, that wasn't good.
No.
I'm moving you, Carol. Okay.
Hey, Dorothy, this is Corey Comer. I'm not in the room also.
Hey, Corey, I'm trying to, which phone number are you?
He's got his name up.
Oh, okay. Manage participants. Corey, where are you?
There's a bunch out here, actually.
Um,
1, 2, 3.
well, we're just gonna have to start talking with the people that are in this room, and I thought I moved you.
All right, well, we can do that.
Yeah.
You want to go ahead and facilitate this? You got a big group, and you got Dorothy and me too, so we'll just kind of sit back and watch from here.
Who is the person you were talking to?
You.
Me? Perfect. Okay, cool.
Go ahead and start.
So,
This is your room.
Awesome. So part of what we're trying to get to here is allowing everybody to really chime in and bring something to the table. And we're looking to discuss a few different things involving employees, involving our patients, and then involving our marketing situations. So I'm going to propose a question, and I'd love it if we could all kind of chime in as to what we are doing in our practices, in our offices, and then kind of bounce these ideas back and forth. And we'll grab 1 or 2 from each of these areas. One of the biggest things that we've been having to focus on is making sure that we keep people safe. But what are we doing in our offices and our practices to keep our employees safe? Because they're coming into contact with people all the time as patients are coming and going, and they're coming in contact with the rest of the staff. So has anybody here set up something specific to keep their employees safe? And it'd be great if you guys had video and audio turned on so you could jump in and chime in on your thoughts.
And feel free to introduce yourself. I know that's one of the parts we kind of got a little bit bogged down. So if you're going to make a comment on something, introduce who you are and what you have, and your organization, your name, and if there's a good lead for you. So.
And my name is.
Go ahead, Corey.
My name is Corey Comer. I'm with Florida Capital Bank. we are small banks, concierge banking, but what we're doing for is what my manager has done or my company has implemented where everybody in the office must wear a mask when you have customers come in, and we're doing social distancing also. And we also, taking clients by appointment. So that's what my office is doing to protect us and our customers also.
Nice. So you're saying by taking appointments, you're limiting the number of people that are going to be there at any given time?
Yes. Yes.
Nice.
That's what we're doing.
And that's actually something like we're doing in our office. We've instituted a policy where patients are staying in their cars when they arrive, and they just shoot us a text message saying, hey, I'm here. And then we will either text them to bring them in, or we'll walk outside.
More than happy to do that. If they really don't want someone in their home, then we can do a virtual meeting and that sort of thing. But eventually we will have to be there. I mean, we've set up for ourselves a COVID program. So, at some point we do have to have someone in the home. So we've set up that program to do that. But unless we're already talking to a prospective client, I don't think we have an online focus. I'm not sure how many we could reach that way.
What's your COVID protocol for your people going to the homes? Do you have something different? Has it changed?
It's essentially what our process is. We will, for the first thing we do with every kind of program that we have a couple specialty programs, but we're going to safety proof the house to start with. So we're going to do, a safety inspection that, you would do for fall risks and all that. But we're going to go in there the first time that we go in, we're going to sanitize the entire house, whether it's a high contact point or a non-high contact point. We're going to clean and sanitize the entire house 3 times a day. If it's an 8-hour shift, 3 times a day, we're going to do high contact areas. We're going to go around and clean. All of our caregivers have N95 masks. They've got gloves, and if we need to, we can acquire gowns. I don't think we're planning on gowns just as of yet, but really one of the things we're focused on as well is limiting how many people come into the house as well. We want to make sure that it's just our caregiver who we know is going to be clean and probably cleaner than even the client and the client that's there.
Are your employees getting tested?
We right now have that as optional, and the reason for that is because since in our business, it's generally one-to-one caregiver to client. If we're taking those steps to make sure that we're having as little physical contact with them as possible, it's not something where we need to go and do every 2 weeks of getting that testing done. Ideally, if that caregiver is meeting with that client for 8-hour shifts, they're only going to see each other.
Okay. Are you having a hard time finding employees?
Not really. I will say that since we hire HHAs and CNAs, we've also connected with the Gabriel Institute, which is a local CNA college. In the past 9 years, he's put out 5,000 CNAs in the area.
Oh, wow.
We're also in the same complex as the Anna M. Mendez Bilingual University. They have a nursing program, so as their students become med techs and are trying to get their RN, if they want to work on the weekends or work at night and that sort of thing, we can work with that schedule, and they can just challenge the test to be a CNA, and we can hire them that way. So we've got 2 main avenues that we can reach out to on top of Indeed and the market ways of the typical ways. So we're not having that much of a challenge finding CNAs.
Oh, wow, that's fabulous. So anything you can think of in your life that's changed business-wise with the COVID?
As a marketer, definitely a lot more virtual calls like we're doing now. But also even doing drop-by visits and that sort of thing, we definitely make sure that, we keep that social distancing even if we come to the community. We have those meetings outside, even though it's hot, and I usually am in full business attire. we still prefer to have it outside so that we're not inside communities and potentially, knock on wood, we don't think we're sick, but just as a safety precaution, we don't want to come inside the community as much as possible.
Yeah, I think that's the same for me. I think that it has changed a little bit. I am more than happy to go out and meet people who are coming to me and usually come in. So, mask up and saves the potential person out there from screening and all that, which we've all gotten screened like 50 times a day. But we're masking and we're talking and we're still connecting, because I think the biggest part of marketing is the lack of connecting, which these things like we're doing today, I think is really saving all of us, because just seeing a person, it's going to be the new norm. It is the new norm. So I feel that working towards that is really, it's winning. I'm excited about all these. I'm excited to see these people in a different way. Do I like staying in my office? No. My legs
No one really
that,
does.
No, my legs at night go, what were you thinking sitting so long? But all in all, I believe we can get through it. I think that the whole thing is already the new normal, because who thought that it would last this long, and it's not going to end anytime soon. So I think what we're all doing, and I think those are good answers, targeting your market, knowing your market instead of just being all around, because honestly, before COVID, I think all of us with any kind of marketing job, it was check the box and how many did you do? Corporate says, how many people did you reach out to? Well, that was how it was, I think, back in the day. I think that's probably, that philosophy is going to change. I think we still have to do it, and new resources of business are new resources of business, but I don't think numbers are going to be the target anymore, nor should they be. Like shame on corporate for thinking that 50 calls a week is just going to be okay, good. You dropped your card off, and that's not a relationship. So
Right.
I think that those words and understanding where you need to go, I think, is important.
Yeah, and I agree with that. That's one of the reasons why when my father started our franchise here, we chose not to do traditional titles. Like, our human resources director is actually our director of happiness. My father is the chief ambassador. My coworker and I are relationship consultants, not marketing reps. So we kind of agree with that. I think as far as the numbers are concerned on the sales side, it's a lot better to have a high conversion rate. Still having a number of clients coming in, that's still important. But I think getting the best bang for your buck, or if you've ever seen Shark Tank, they'll always ask you, what's your cost of customer acquisition? I think that's a lot more important than trying to go out there and have 2,000 contacts or, what have you in a month. So I think that's an important part.
No, I think that's a good point.
Yeah, can I ask a quick question? Stephen, is your location where you're going in and keeping people at home versus Carol, who has a facility where they bring patients in?
Correct. And essentially we go to wherever they are. That can be in their home, that can be in an assisted living facility or independent living. And we've worked with assisted livings and independent livings that when clients or residents said, you know what, we're a little nervous, we want to go back to our family's home for a little bit until this dies down or what have you, or if the facility has a waiting list or something along those lines, we can fill that gap and make sure that that person's being taken care of so they don't deteriorate to going to a skilled nursing facility, and that we make sure that once it's time for them to go back to an assisted living facility, that we can send them direct to that individual that referred to us.
Okay.
Yeah, and I think Stephen's connection with the veterans is very valuable in and out of assisted living, to understand that they can get some care that is paid for.
Mhm.
Yeah, I mean, I think that that's a huge benefit and good to know. So honestly, personally, just very happy that Stephen's in my little pod here.
Yeah, well, I started to say, especially as much that you do with veterans. I mean,
Yeah.
what a good bridge.
And Dorothy, that's why we love you.
I'm a pun person too. I like it.
Exactly, where is your office? Do you have an office?
We have an office. Ours is, we're in the same complex as the Ana Mendez University. It's South Cimarron, probably about 3 miles north of the airport, just north of Lee Vista, where Hoffner and South Cimarron meet.
Oh, okay, no, exactly.
Yeah, we're the northeast corner of that.
Okay, all right. Probably go by there now that they've cut off my entrance to the 417. So now it's 3 days now, and I still get in the car and go, I have to go where? So because I'm coming from Lake Nona up to here, so now.
Oh, you live in Lake Nona? That's where my father lives.
Oh, very cool. Yeah.
Yeah.
Love it there.
Nice.
And yes, Dorothy, I know you came in kind of in the middle. I work with a place at home. We are in home care at the companion and homemaker level right now. We filed for our personal care license, but it's going to be a month or two, maybe a little longer before they approve us. But that's essentially our business, what we do.
So if somebody were paying Stephen for a sitter, can we say that's what they are in your business? A companion?
We usually say companion or more preferable caregiver.
Okay.
And we can do anything from, sitting and talking with them, making sure that there's a good conversation so that the cognitive abilities are continuing to be worked and what have you. One of the things that we really harp on is we don't want our caregivers to be idle. We're not babysitting. We want to make sure that there's something being done, that there's always something that we can do, whether it's cleaning or laundry or meal prep. We can do simply companionship, but we'll probably play games with them or we'll have a conversation.
So if somebody were paying for that, is there a minimum hour per day, and what would be the general cost?
We do not have a minimum hour. That's one of our key differentiators between us and some of the others. We start down at the low 20s.
Okay.
And then we, kind of what you would do as far as if someone's coming in, you determine what the care needs are and you adjust the care level and prices accordingly.
Right.
But we start down at the low 20s. We are an agency. We are not a registry.
Okay.
And then one of our other key differentiators, we do a 103-point home safety assessment, which I know a lot of communities or companies do an assessment of some type. We go room by room by room by room to the garage, to the backyard, to the front door, and we just make sure that we've got the mats are all tacked down. We make sure there's no cords hanging around. We do that sort of thing, even checking to see if the furniture is too close together, making a narrow gap for them to try and navigate through. And then we have one of the other unique things to us, we have a 48-hour caregiver satisfaction guarantee, and we market that guarantee. We haven't seen anybody else, even in Florida, doing any type of guarantee where from the moment we start care, if they contact us within the first 48 hours and say, I think we're not quite 100% gelling with this specific caregiver, can we try someone else out? No problem. We will credit you the hours that have been worked and assign a new caregiver to that account.
I think that's spot on with some things that are needed out there. Certainly the home inspection used to happen back in the day. I think I totally agree with you. It doesn't really happen now. So, you know, bravo to you. And that just coincides with what we're trying to do here. When they start to move in and they bring the new 8x10 carpet to put under the table. First of all, no tables, please. And second of all, no rug, please. And yes, and you will fall right between that chair when you dropped your remote control. And so, no, we're not having that either. So very respectful of that with you. You know, for us, the companion is sometimes what I contract with to help a new move-in be successful because they're scared. More anxiety in this situation than not. So I am beginning to invent a move-in package with someone like yourself to assist. Back in the day at my other community, I used it quite a bit. Here at the bridge, just starting to initiate that. Here a little bit more due to COVID, just because the 14-day quarantine and the families thinking, what are they going to do? Well, you know, to be honest, they're really busy compared to when they were at home alone. So, but, you know, to ease that process, I think something like you would really benefit. So for that first 14 days, try to give them some extra hands-on eyes on that, you know, they can't come out to activities and they can't do that, but certainly we can go in and we do keep them busy, but it's hard for the families to understand what that looks like. So having you know, someone like your caregivers would I think be a plus.
So can I ask a question? So if you guys work together for something like this, would Stephen make sure that the client is free of COVID or has that 14-day waiting period before they were to transition into your facility? I mean, how does that work?
Well, at the current time, and the things change every single day, but at the current time, they would just be screened twice a day at our front desk and fill out the form. So at the moment, they don't have to be, we now have to be screened every 2 weeks. And that's assisted living SNF wide now. So that will have to be, we've already been tested, but now this is just in stone. Every 2 weeks has to be accomplished by the 7th of July. Of course, ACA made the rule, but didn't make the plan. So,
and you just had somebody new come into the room. I don't know. Could you introduce yourself?
Oh, hi. This is Celeste Thomas.
Hi, Celeste.
Hi, how are you?
Good. And what do you do, Celeste?
I place all the movie theater advertising.
Wow.
So, and we're getting ready to get back open. So, health and safety and all those things are very important to us as well.
Understood. So, been a long, long time for you.
Mm-hmm.
Yeah.
Yep.
So what's your plans? Anything new and different that you're thinking of, or tips for us?
Well, just my own personal observation, I just find that people are not taking this very serious. And I think that there's so many people that are getting misinformation, and that was one of the reasons I joined the call as well, because I really wanted to learn more. Because since this whole thing started, my father, 91-year-old father, has moved in with me, so I really need to be very careful of my exposure so that I don't bring something home to him.
Good point.
Yeah.
So the more I can learn, the better I feel like I am equipped to deal with everything.
Yeah, you know, the sense of anxiety, like we were talking before you joined the room, is certainly heightened, but I really go with just do the right thing all the time. Just do the right thing all the time. You can only be responsible for yourself. And that's what you have to go by, especially with your father then living with you. I don't think that, I mean, we have choices. I think some of my friends feel like, oh my God, can you believe where Carol works? Look, I mean, why is she doing this? But in actuality, I'm probably safer than most of the people. because I am doing the right thing. I am being screened. I do know what protocol is every minute of every day. So I think, Stephen, you probably can attest to that as well.
Yeah. Yeah, I think just having that constant, because we know in our business that we need to be clean at all times, and that's been throughout our entire careers, and seeing it.
When that's okay, there might be that's when that referral would come from that discharge plan or from a rehab or something like that and those are people who, like I said, they have some emergent need. They're either going to need assisted living, they're going to need in-home care for sure. There's less choice in the sense of needing care. Now there's always, at the end of the day, there's always choice about how you're going to get that care. Because honestly, if virtually anyone who assisted living is appropriate for, an in-home stay could be appropriate for if they can get the right kind of in-home care coming into the home. It just depends on whether they want strangers, so to speak, in the home, the resources that they have to pay for it, all the various things that go along with that.
So if they have the resources to pay for it, are the resources still there, or is the demand outweighing what resources are available? Because people might elect more to stay at home, or?
I mean, not that I've heard. I mean, so from the in-home care companies that I've talked to, they've been seeing sort of some up and down because part of the, so they have people who have added services, but then they have people who, well, now that maybe a family member either has been furloughed or laid off, or even if they're able to work from home, they're at home. And so even if they are working full time, they're in a position where they can still, they can now provide care for that loved one who before an in-home care company was coming in. And so maybe they don't need that person coming in for shifts. So I think there's ebbs and flows in that marketplace. I have not, besides at the highest level, there's been kind of a need for the CNAs and home health aides and med techs who work in those kind of caregiving roles, and an overall sort of, there's always a shortage, so to speak, of those types of folks. That kind of ongoing, but not like, oh my gosh, emergency, critical, we can't care for the population that's out there.
Okay, makes sense. So on the and we kind of talked about the patients and the marketing. So I did want to talk about employees, John. I know, like you said, you don't necessarily have employees. You're a one-man team.
I'm keeping myself as safe as possible.
You're staying in that one room, so you're nice and safe.
Well, yeah. I mean, for me, I'm not overly. I'm in my 40s. I'm physically active. I'm not all that concerned about me per se. I mean, I don't want to get COVID-19 by any means, but my concern more is because of the industry I'm in and the potential for interaction with vulnerable populations because of that. If there's not a real need to be out in potentially scenarios where I can't social distance or putting myself at risk to thus then become a carrier to somebody else. I mean, I've certainly been avoiding that. I wear masks. I wear a mask if I'm out going shopping and in public that way and all those things. So I think it's only right to take those precautions for anyone really at the end of the day, and take care of that. But no, I don't have a physical, I'm not a brick and mortar place. I don't have employees coming in. I haven't had to put up, plexiglass screens or signs saying, keep your distance, all those things that other businesses might have had to do.
And we kind of talked about this earlier, John, but then, so are you having any in-person contact with communities or with clients, or is it all virtual for you?
So far, really everything's been virtual. So a week or so ago, I had coffee with a couple different, professional folks, and that was really the first kind of outside meetings I had with a couple different people. And fortunately, it was a one of those few days where it was sort of cool enough to not be the worst, you know, day that sort of some storms had come through, so it was cloudy and it wasn't, you know, awful surface of the sun heat that we often get. So we were able to sit outside, which is, you know, nice. One, because, you know, you just know it's a little better. There's air moving around and those things. But, you know, if certainly there have been meetings that have happened with others I know of, both locally and with other owners, and, you know, 100% we would wear masks and, you know, do it in as safe as way as we possibly could, for sure.
So Dennis, you've had a couple more people come into your room. I'm not sure if they're the same person or not, but I don't know if you want them to introduce themselves.
Thank you, Dorothy. So our co-facilitator, Dorothy Hardy, Annie Reyes. I don't know if that's your phone number. Annie, can you introduce yourself to the group? Just your name and your business and what you do, please. Annie, are you there? Okay, you got the phone. Go ahead.
Oh, okay. Good morning. My name is Annie Reyes. I'm the clinic administrator for the WellMed at Semron in Hoffman.
Okay. Annie, you came in the middle of a conversation, but we're talking about, and actually, whatever is applicable. We're talking about our employees, our patients, and for some of us, that might be a resident or client, or I work at Kaiser University, so they're students to me, and marketing. So in this COVID-19 environment, talking about employees, we're just talking about employee safety, and John's a one-person team, but also he does need to keep himself safe. And then technological challenges you've had with patients, telemedicine, and then marketing, how we're proactively reaching out. So do you have any personal experiences to share with that as far as keeping employees safe, patient use of technology, and reaching out to potential for marketing?
It has become a challenge because of the new format that we have to follow. Maybe my area, the demographic is more geriatric than young people, and so they're scared because of what's going on. They don't want to come out. They don't want to go to the blood work. They don't want to even pick up the medication, the pharmacy. So we're trying to work our way around it. You know, calling the pharmacy, make sure that the medication has been delivered. We're offering them, obviously they're not into technology, so telemedicine for them is a challenge unless they have somebody younger that can walk them through. So we're trying to do that before the visit. We're trying to get the MA, my medical assistant, or my front personnel to explain to them and walk them through, but it could take us a good half hour just to explain to them if they can get through, because most of the time we can't get through. So it is a challenge. We cannot see as many patients as before due to that. So we're going to minimum, maybe we could see like 12 patients before or 10. Now we're down to 6. So it's not easy. We're trying our best, getting all the safety, the guidelines. We're guaranteed that when they come in, I don't have no more than 2 persons in the lobby. We're telling them they're not going to touch anything. Once they get to the door, we put a doorbell. They're ringing the bell. They come in. We check them in. The medical assistant goes out, opens the door for them. They come inside to the room. They don't touch anything. Either we give them a gram pad, and they can talk to the doctor right next door. Right next.
Energy, power, gas, healthcare, digital services, all of it. I mean, it's 400. Yeah, I think, one of the recent numbers is like 450,000 employees globally. So
I believe it. Hey, Joseph, I got to cut you off. Dorothy popped onto our screen, and so
No, I'm just being nosy. I'm just flipping from room to room.
Well, we finished our questions. We have a really diverse team here, and then there's someone we couldn't get in, but Carol Colin.
Yeah, we had a couple people that were having a hard time, and so if they called in, they may have gotten flipped to another room.
So,
Oh,
but
wow.
great group, great group. You know, Joseph is doing those high dollar MRI and imaging stuff, and Bria is she's out there meeting with physician offices and dispatch coordinators and referral coordinators, and it's trust me, I can remember 25, 30 years ago when I started in this business doing what Bria is doing right now. God bless you.
So did they have any issue with her, I mean, with you going into these offices and you're physically going into the offices, right?
Jump in, Bria.
Yeah. Hi. Yeah. I was saying how normally, you know, if they weren't on lockdown, I'd also be going to rehabs and hospitals as well. But since a lot of doctors' offices are open, you kind of have to, you know, play each one by ear in the sense that a lot of family physicians groups, for example, they have a sign outside, and I normally just wait outside and someone comes to meet me out there, or other offices I'll physically go into. And for example, yesterday, this was the first time that they told me, oh, you know, we're kind of reevaluating things. We don't want reps in until, you know, after July 20th or something. So it kind of depends on the office. Some of them understandably don't want reps. Some of them, it's normal. It just really depends on the location.
Now,
hey, do they put that electronic optical temperature gauge to your forehead when you show up?
Oh yes, they do. They do have a lot of that. Because sometimes, for example, with family physicians groups specifically, I'll be like, oh, it's okay, I don't have to come in. I just wanted to stop by, you know, here's my information. So I don't want to, you know, make things complicated. But yeah, no, they definitely do have temperature checks. And they've been doing that for a while now, even before quarantine started happening, especially with rehab facilities. But yeah.
Do you cross over county lines with some of your territory?
Yeah, absolutely. I cover Seminole, Orange, and Osceola counties.
Okay, because I started to say, I know Orange County has the mandatory mask now. So does Osceola. Seminole, they're not there yet. So I didn't know if you were seeing that they were complying with these orders, or if they're being stricter with what they're doing, or.
Gotcha. Well, I mean, I always wear a mask and gloves when I go in. And then all of the staff, I see all of them wearing masks wherever I go in. I mean, a lot of patients are wearing masks, but at least the offices themselves, it looks like all of the faculty they have masks on, so.
Nice, nice. And will you remind me what company you're with?
Yeah, it's called Utopia Homecare. We do both non-medical and skilled services. So we pretty much dabble in just about everything. And what's awesome is that we take a ton of insurances as well. So we're, you know, pretty inclusive to all patients, as well as the managed Medicaid and Medicare as well.
Nice. And Joseph, what company are you with?
We lost
Hi,
Joseph.
sorry. No, I'm sorry. I started talking and then I forgot I didn't unmute myself. So I'm sure that happens, you know, 30 times a day. So yes, I work for Siemens Healthcare.
Oh, nice. I'm glad you guys got on.
Yeah, and I am going to see some facilities similar to Bria. I've gone to some of my customers and they have a sign on the door that just says, like, if you're not the patient, like, you can't come in. It doesn't matter if you're a spouse, if you're a rep. And then, you know, I have some customers that I go in and you have to fill out a questionnaire and you know, sign it under penalty of perjury that you haven't traveled and that you're not, you know, you haven't coughed or sneezed in the last 14 days. And, you know, and then I have some customers that you can walk in, you don't have to wear a mask, you shake the people's hands. So it just, I have a wide spectrum of customers.
All right, they're calling us back to the main room, so.
So, well, you've got 45 seconds. So just if you've got anything that you can wrap up, that would be great. You guys are done, so you can certainly hit the main session. So
This is a great group because it's got a lot of diversity in it. I learned a lot. So I appreciate both Bria and Joseph sharing their thoughts.
good.
Bria, do you receive, or does your office receive the digital Orlando Medical News or our newsletters or anything?
You know what? I think I may have received some emails, at least to my email, so I'll definitely have to check back and if that's where it's going.
Just curious.
Yeah.
Just curious.
Can you say that again? I'm sorry, I didn't hear you.
We had everybody jumping back into the new room, into the main room, Colin. So I think some of the folks were in mid conversation when we're jumping in. So we had a glitch where we were in the main room was our room for those that are joining us now. Back to Colin. So so I think there's going to be a survey that pops up or a poll. I don't know if Dorothy got that sent, but I hope that you kind of like this, if you can take a few minutes just to answer some questions like this format, and we're going to kind of bring our facilitators here together. So if you can take just a few minutes to answer these questions on the poll. We've been trying to figure out how we can bring people together and keep some conversation going so that you don't have 30, 40 people talking at the same time. I think we've had about 20, almost 30 people on this call. 27 is what I saw jump back in. But I'm going to, at the same time, while you're answering these surveys, I'm going to bring in our facilitators just to kind of recap what was discussed. I know some of us, we went on some tangents, which was great in our room, and talked about different pieces that were important to us. So we want to share those, and I think Dorothy might be whiteboarding them behind us at some point, or taking notes, and we can kind of recap this for everybody. So let's start. Colin, I was in your room, and let's go ahead and let's do this. I'll start with Colin, and I'll go around. If there's anything that is that we said and chimed on there, if it's already been addressed, but we'll start with the employee side. What were some of the things that you heard from our group here about keeping employees safe to report back to the main group here?
Sure. All right, Dr. Colin Bartow here, guys. Hi. So in our group, we talked about a few different things, and obviously the shift more toward telemedicine creates a nice bubble of safety. But for those industries like mine, where it's a chiropractic office, we are a touch practice. We have to have people coming in. Having the car waiting room or the car triage set up where patients will stay in their vehicles until brought in reduces their exposure to different parts of the office. And it also reduces your administrative staff and other individuals in the number of patients that they'll see or come across, if any. So we can really reduce that exposure in that type of a format. Also, of course, masks and, wiping things down, washing hands, that standard procedures.
Carol, anything from your group that differs from what was there? Did you have any innovative or any interesting things that came out of yours? Oh. Carol, we lost sound, so hold on. Try it again.
Most of our conversation was about the marketing piece, just because
Okay.
it was in our group. So it was really interesting and a great.
Okay, well, we'll jump back for you for more of the marketing piece.
Okay.
Let's see, Dennis, did you have any discussion about employees keeping them safe, and what were protocols and things that were handled from your group?
We did. We also talked about, and kind of parallel with the telemedicine, but working from home. So, and then if we do have teams of employees, half working from home, half working in, so it may not be the complete team is in. If they are there, we also talked about cleaning and disinfecting too. That the car waiting room is a great idea, but the office on our group kind of had people ring the doorbell. You have a greeter go to the door, so that at least eliminates the waiting room. But then once somebody is there, disinfecting any space that they're in.
I like that, the doorbell. That was one we didn't hear in ours. John, did you guys cover any of that in yours?
We supplied the gloves, the sanitizer, but something that was impressive was something that Joseph shared out of Siemens Health. Not only were they providing PPE and hand sanitizer for the employee, but they were providing it for the employee's family, which I thought was, wow, that really is caring.
That's a great piece. Quentin, how about you down here? Did you get what were you talking about? Anything with keeping employees safe and the protocols?
Well, I really enjoyed everyone's input. I mean, I think Brianna really, she demonstrated that her organization is adaptable. They started out going one direction, and when they recognized that direction was creating risk, they adjusted. So now they're, they will have someone go out to the vehicle. They used to, one of the things they were doing was allowing people to refer a family or friend, but that created risk. So they modified that. I also very much enjoyed Keith's part because he's going actually to the offices, and he's really trying to refresh them on what things he's observing as he's engaging with other practices and what are some things they can do. We did discuss using your newsletter more to identify or set the parameters for the patient visit. And we also talked about making sure that those common areas, doorknobs and chairs and those common areas where you're getting a lot of patient flow and traffic, that you kind of keep those clean and keep those sanitized because people are coming in and out. But I think overall, there's a consistent feeling that everybody is exercising their due diligence, and that was impressive to me, to know that there's a unity with regards to how healthcare should be working.
So you kind of said it. Were there any other protocols? You talked about the wiping down, but anybody else that had things besides common pieces? Is anybody doing anything different regarding protocols?
It's John here. Came up with some good stuff. One person per elevator, no cafeteria, stair walls designated up and down. Thought that was pretty proactive.
Dennis, anything on your end different?
No, you covered all of it, so nothing else.
Carol?
I think that's pretty much the same. I think the word sensitivity to the anxiety is what drives all the solutions.
All right. Colin, anything you want to report on our group?
No, it's pretty
Sounds
solid.
good.
I like the stairwell one. That's a good one.
Yeah. We talked a lot about, we did a lot about the backup plans or some thoughts with the employees in a group. Dennis, what did your group come up with? Did they have any backup plans for if they had a patient and or a client or employee get diagnosed with COVID, with what their plans were?
We didn't discuss it, but I could tell you at least at Kaiser, and we've kind of gone through this, is that if they've had contact with somebody, we're quarantining people who have had contact with somebody. And then and I know a lot of you are healthcare facilities, but I mean, as a university, we have faculty members who teach classes, so they're scheduled to teach the class. Luckily, we've been online, so even if someone is self-quarantined because they've been exposed, they might have or they do have it, as long as they're well enough to teach, they're home anyway, so they're not going out and having contact but again, if any of our employees, we would keep them home for the quarantine period. If they have had direct contact with someone who is known, we will quarantine them as well. And then even though we are a teaching facility, the challenge that we all have is that you work in a healthcare facility, you get in contact, and particular nursing students have contact with people with COVID. So what do you do then? So we're being on the cautious side and quarantine if you were in contact with someone with COVID.
So,
Right, John?
Dennis,
Go ahead.
can I quick question?
Yes.
So let's say that you've got someone that was self-quarantined because they were exposed. Do you require them to have testing before they're allowed to return? Or is the 14 days sufficient for you?
That's above my pay grade, Dorothy. But
Stop, Dennis.
Dorothy, maybe we should change it to Hardy University because that sounds like a great policy. So let's throw that in there to test before you return. So,
Carol, how about your group there?
Well, I mean, I think it's just what you all said, that there's nothing specific, but all the general practices, just always doing the right thing. And again, don't have an answer about that. I know personally for our building, what we require if someone is exposed, but it's different, I think, than practices.
Quentin, your group?
I think we basically, again, and I may have mentioned this even in our prior, if a person is showing any of the identifiable symptoms, or let's say they have a cold, a cough, upset, any of the individual symptoms that could potentially morph into something else, the recommendation is get that behind you first and then schedule your appointment. Because the challenge is COVID is a virus that disguises itself, and it comes on you one malady at a time, and then all of a sudden you're fully blown. So if an individual is demonstrating one or more of these maladies, it is probably in the best interest of the practice to reschedule that person's visit. And it may be an extreme circumstance, but as a general rule, it is better to be safe than sorry.
Mm-hmm.
And Colin, I know we had some robust discussion. What did you want to report on that one?
Yeah.
Oh, we got you muted. Hold on. You should be good now.
Okay, cool. Yeah, I mean, it's for our particular group, it was a little bit different. You know, Dr. Barbosa is doing primarily telemedicine at the moment. So if she comes down with it, well, then she can quarantine herself, you know? And for me, if my little office has, you know, myself or one of my 2 staff members that are, you know, showing these signs or symptoms, then we have to close the whole thing down. We've got to, you know, disinfect everything. All of us have to get tested, and it's just, you know, it's kind of all or nothing, and it shuts us down for potentially 2 weeks or more. So it's at this point, precaution and prevention go a lot further, and so that's kind of our game plan, is we just prevent as much as possible, and then if something happens, we just have to close it down and reschedule patients until we're ready to go.
Very cool.
If I could jump on quickly again, Quentin, thank you for the symptoms. It reminded me that, and that's the thing is, we have had people that are tested, but then they're negative. So then it's like, okay, well, they're fine to come back, but then they were showing symptoms. So it's like, if you are showing symptoms, do not come to the campus. And then we are doing temperature checks as well. So if anybody, employees or students come to the campus, we're doing a temperature check of everyone that comes into the building.
And that was something we talked about. We have a waiver when we have folks come in that are signing a release form if they're visiting the office. So that was another thing that we did on that robust part of that conversation.
Andrew, I'm kind of curious, are any of the offices putting waivers in place or any kind of, acknowledgement?
Well, we have found just on a chamber side, we've talked with a lot of our hotels and things where we're trying to figure out, what they're doing in pieces. A lot of them are doing the same type of checks, but a lot of them have a questionnaire or a type of waiver protecting them with that. We haven't seen it with restaurants or anything with that, but we've seen it when I've been out on at least some of the ones with our members. They've been doing a really good job with the spacing and the masking. But I can also tell you I've seen others that are not following the guidelines, and that's the scary part. And I've got some things to share with Dorothy that we may put together is, the CDC has put out a number of guidelines, and the medical professions, I think, jumped right on it. They get it, and they've already been doing a lot of this as a protocol for cleaning in pieces. But I think for the rest of the business world, this is new or different from what they used to do. So it's a challenge. And I've seen that. I'll be honest, I went out to dinner last night, and it was not paper menus, and I was like very kind of like I was washing hands. I was out at another place, and I couldn't find a hand sanitizer anywhere. And one of the soap dispensers, there were only 2 soap dispensers. One wasn't even filled. And it was like, there were 2 sinks that weren't working. And I'm like, how can you even be open with this? And at that point, I'm like, I'm out of here. And nobody was wiping down, but the staff had masks, but then I'd see them take the mask off when they weren't around somebody and put it back on. And so I think for a lot of challenges for business, and I'm just reporting on what I've seen, it's different from what they've ever had to do or worry about, and they just don't know. So,
by the way, did you at least let the management team know? Because if they're doing it to you, it's probably applicable universally.
I will say that the 18-year-old manager that was there had no clue. So,
getting your food, right?
Exactly. And I'm like, business is not as usual. So I've got some ideas for Dorothy for what we might do for some chamber virtual events. But anyway, I'm a sidebar. I want to let this be about medical and about what you guys are doing.
And Dennis,
do we have?
Oh, go ahead.
With any of the other groups, do we have medical offices that are using waivers for patients that are coming into a physical space with the teams?
And Dennis was commenting that his the orthodontist, and Dennis, you can speak.
Yes. Yeah, no, sure. So we do at Kaiser. So yeah, I know we're an educational institution, not a medical office. But my daughter had some dental work that needed to be done, and she goes to my dentist. So our dentist has a waiver, and then her orthodontist has a waiver as well. I think it's funny, the medical facilities are more of a questionnaire, and I think Andrew may have said that earlier. It's kind of hey, are you showing symptoms? Are you in contact with someone showing symptoms? At Kaiser, it's kind of like, hey, we're in the middle of a pandemic and you're putting yourself at personal risk by coming out. So depending upon the wording, we do, yes, have something at Kaiser, and then my personal dentist and my daughter's orthodontist have one, yes.
How about on this call? Does anybody implement a waiver?
It doesn't sound like they have.
Celia was trying to speak. She needs to unmute.
We have not either. We have no waiver. We just have a questionnaire, you know, signs and symptoms questionnaire. You know, I don't know. I haven't been anywhere. I've been to several doctor's appointments, and in the ones that I have done, participated in personally, there's been no waiver. There's just been a questionnaire regarding signs and symptoms, up to and including I had a procedure done at a surgery center, and there was no waiver there.
Wow.
Oviedo Medical Research, we're not doing a waiver either. I don't think the private practice is. We're doing a survey. We're doing question. We're calling them first. We're asking when they walk in the door. We're doing temperature checks. That's it. There's no waiver at this point.
Andrew?
Yeah.
I can share that experience I've observed at Nemours Hospital is someone's scheduled for surgery. They bring them in the day before for a COVID-19 test. And if the patient doesn't make it and they show up for surgery, they do not cut. They send them home.
That I have seen. My father was in for surgery, and I think he went on the Friday before to give it that 48 hours on the results of the testing prior to going in. So I do know that is happening in some of the facilities that offer procedures and whether inpatient or out.
So are you guys saying if you want to get results to your COVID-19 test, you schedule surgery?
Exactly.
Sounds like it.
Well, cool. Well, I want to keep us moving here. Let's talk a little bit more about patients. Did anybody get into the technology side and issues with telemedicine? Did we go into any of that? Let's, Quentin, anybody in your group talk about that one?
Yes, and one of the things we talked about is whether or not that's going to be a permanent fixture. We also talked about how long insurance and Medicare and Medicaid is willing to front the deductibles associated with that. That is a concern, but most see telemedicine as a reasonable solution to patient care, especially when you're dealing with older patients who may not be as mobile. This is a great tool. The only concern that was observed is the making sure that an assessment is just a pre-qualifier versus giving a decision about a person's health, because while the patient may give you verbal descriptions, nothing is the same as seeing that patient. So making sure that you use it in a pre-qualifier way, verifying insurance and all those things, then doing a general workup of symptoms and giving prescriptions, pain meds via telemedicine is not something some practices are willing to do without seeing the patient. So those were a few things that we discussed.
Great.
So-
John, go ahead, Ken. Go ahead, Dorothy.
Well, and Stephen pointed out that it was a key item on their needs list when the company was looking for a company health insurance plan. He's with a place, did I get this right? A place at home? No, wrong one. No, a place at home. Okay, yeah.
There he is. John, anything from your group on, did you touch base on the patients and technology?
Yes, a couple of things. To Quentin's point, CMS and all the carriers have issued billing codes for home health, I should say for telemed visits, so payment's not going to be an issue. As for from a marketing perspective, I really like what Joseph shared. they are doing virtual site visits. They've got a pretty strong, they must have one heck of a marketing department. You know, you get to that point in the process of a sale, selling those big machines, and it's time for site visits and testimonials. And they're actually now participating in virtual site visits. So I thought kudos to them.
And then how about you, Carol? Anything on your group? Did you talk about anything with patients and technology and the pieces there?
Yeah, I think it just varies to what industry you're in as to how well that works. We certainly agree with what you said, that it's a precursor to everything, especially in the aged population. They have a difficult time with it. It takes much more time to do it. But we totally agree that it just is the thing that is going to happen, but may not work for all of us.
Gotcha. And Dennis, did you guys jump in any of that?
We did, and that was probably more applicable for all of us. And whether or not it's telemedicine, because some of us are not necessarily working directly with patients, or it's not necessarily the visit. So we talked a lot more about, it's like a lot of this video technology has been out there, but we haven't been utilizing it or utilizing to its fullest capability. So now it's finding out what platform, as far as Zoom or FaceTime, works well with us and our client or patient. Again, it's not necessarily a telemedicine visit, but again, it's what technology can we all use. And sometimes we can't get all of us on there because we have a business that works with assisted living facilities and residents and kind of as a matchmaker. So it's like usually he'd be in there so that the three are together, but now it might just be the potential resident and the community. And then on the other side of it, some of it hasn't changed because initial contact might be a phone call anyway. So we might have an initial phone interview. That hasn't changed. It's trying to figure out what virtual platform are we all using. And then touring, and that's what we were just talking about as far as, okay, we used to tour in person, so now we're doing a virtual tour. Those businesses that already had maybe a virtual tour already, a video or good pictures that kind of demonstrated what they had worked out well. Telemedicine specifically, I mean, obviously the geriatric population is challenging as far as using the technology, but maybe using a younger family member to help with the telemedicine. And then also employees, so that having a medical assistant walk through. So, but again, reiterating what people had said earlier, more time, more people to have the medical assistant walk through the technology before the patient actually walks through the technology with the doctor.
All right. And Colin, anything else you wanted to add?
Yeah, I mean, it was really kind of looking at the expanded exposure. You know, we had Dr. Barbosa, who works with, addiction patients, and being a limited resource, there's not a whole lot of these addiction specialists out there. So she has a much greater reach by using this technology. And if this stays the way, it's trending, that could potentially help more people. For me, it's not as helpful, being a hands-on kind of practice. We really don't do much in the way of telemedicine. But it seems like as a whole, it could be a really good thing for, our country as a whole, where we are moving in that availability for patients and being able to provide services for individuals who may have transportation issues or mobility issues, and meet people where they're at. So I'm excited to see how it goes.
Yeah.
Yeah, and Celia has said that some of the doctors that were a little more resistant to learning something new have done it, and now they're pretty comfortable, and their patients really like it too, so they see the potential.
Yeah, and Stephen said that they were using that with his company for looking for health insurance plans and pieces like that. So let's jump into the marketing because we're running out of time here. So I know this seemed to be a hot one here. So Was it Dennis, your group, was that the one doing more marketing that you guys jumped into, or was that John? Somebody had more marketing.
I forget. I think it may have been Carol's group, but I'll jump on and then maybe Carol. But as far as our customers go, and again, most of our marketing is either bringing people in, again, those initial phone calls. So we have a website that attract people, so that really didn't change, word of mouth. But particularly working, we talked about assisted living facilities versus skilled nursing. Skilled nursing, it's not a choice. So I mean, they have the need there anyway. Assisted living facilities, someone might be doing home care instead of assisted living. And then the other side of that was the people might have family members who are working from home now, so they might not need someone to come into the home to care for an elderly family member. So we're seeing stuff pick up as people are starting to go back to work. But as far as marketing goes, it's kind of ebbing and flowing, and not necessarily new marketing strategies. So we didn't have a whole lot on that. So,
Carol, give us an overview of all the marketing pieces that you guys talked about, and we've got to wrap up in about 3 minutes.
Yeah, I think that marketing is still relationship based, but we discussed target marketing, whereas perhaps before COVID it was, oh, just touch as many people as you can and I'll give them your card and hope something will fall. But now it's a more targeted cost of customer acquisition comes into that, and so a little bit different attitude. I think that just because of the limited ability to reach people. We discussed how this call and this smaller groups was amazing. This is the best thing ever. Everybody agreed with that because of the water cooler conversation, and then maybe going back to a bigger group, but gives a lot more people ability to talk and verbalize what is going on for them and what works for them, and then we can share. So I think target marketing, same platform, maybe just different methods. Obviously a lot of virtual, a lot of meetings, but this meeting is certainly unique and special, and I think will work in many avenues.
Quentin, how about your group?
We discussed now is the time to be proactive versus reactive. If you've got patients you haven't seen in a year to 6 months, instead of waiting for insurance or some normal methodology, if you want to keep your doors open, give your team member a list of 5 to 10 patients to call a week, or not a week, but maybe a day, and just get on the phone and start talking to people to get them on the appointment book. And as long as they're healthy, wealthy, and wise, it's just a friendly reminder. And just remember, when they're making those calls, their mission is to keep the doors open for the practice or the business. So it shouldn't be, I don't want to make these calls, because you're securing your position and the company's position. And if you figure, I think the number we used, if you do 50 calls a week, and let's say you get 20 people or 25 people, that's 20 to 25 people that you get on the schedule, 60 to 80 a month. That can make all the difference in the world in your practice.
John, anything from your group?
I mean, basically, we touched on the same points: leveraging technology, basically just being out there.
And Colin, I know we didn't really get into the marketing piece. We were working on a lot of that, but anything you want to add on your end, and then sum that up?
Sure, yeah, it really came down to maintaining contact with your patient base. You know, we tend to be referral driven in a lot of situations, and so making sure that your sources, making sure that your patients know that you are open and accepting new patients, and then doing some newsletters or some phone calls to kind of touch base with those older patients that may not have been around for a little while, like I'm saying. Those are fantastic because we don't have a lot of the in-person networking right now. So it's all about that leverage, like John said.
And then Carol, I'm coming back to you because I'm going to let you wrap this up and say a few last things and anything, final messages that you want to say from the bridge.
Well, thank you for joining. It's always a pleasure to see and be with the chamber members. I really appreciate it. We are open and accepting admissions, and that is the that is the message. And it is shocking to some people. In our group, we talked about how you have to see, you have to smell, and you have to experience. And I think for us, that is how I market and how I make sure everybody understands that we are here for you. So
wonderful. And we appreciate everybody that is here. I'm going to share this real quick just so that everybody can kind of see what's here and end this. I hope that you really enjoyed what we've had here and what we've put together. So with this, let me find the slide I was looking for. Here we go. But just to let you know, for those that are interested, we have Latte with a Leader, which is tomorrow. We have Representative Coach P. Renee Placencia from the state of Florida, who will be on a virtual call with us at 9 o'clock. If you're interested in hearing some detailed information and have questions for our representative, please feel free to sign up for that one. And then next week, for those that are in marketing, we have Will Perry is back, and we had him on a webinar last week. And we've got a series that we've put together, but how to create irresistible offers. For those of you in marketing, this is a great opportunity for you. So that'll be on July 8th. And all of this is found on the East Orlando Chamber website with those. And if you've got questions, but I do want to say thank you all for attending. Thank you, Carol, for being a gracious host with this for the first time. The poll showed that I think everybody enjoyed this. And we've got some ideas for pieces there. So I really appreciate all our time. Thank you to all our facilitators and everybody that was able to stay on to the end. And we will be reaching out with plans for how we'll continue this in the future. So without further ado, I'm going to say thank you very much, and let everybody head on their way to their next, whichever it may be.
All right. Thank you. Have a good day, everyone.
Thank you, everybody.
Thank you, everybody. Goodbye.
Take care. Have a great one. Stay healthy.
Thank you.